if the Labour Party win the next UK general election, which they are looking very, very likely to do, the assumption would be that Wes Streeting, this chap that we can see in this photo here, would be in charge of the NHS and the UK's kind of health provision. And he wrote an article stating that he thought it was bad that the NHS every winter uses the fact that things are difficult for a healthcare system over winter as a kind of excuse to ask for more money. So this is a kind of well-known thing that all healthcare systems the world over have to deal with, is that in winter, people get sick more. In the UK at the moment, we have a energy crisis wherein energy bills are going up and up and up. So winter leads to more people being ill, and this can put a strain on individual hospitals and the healthcare system more broadly because people need treatment. But Wes Streeting has taken the bizarre decision to, rather than doing the standard thing of promising more money for the NHS, as politicians tend to do come election time, he is already suggesting that an incoming Labour government would not provide any additional funding to the NHS. When the Tories talk about the challenges in the NHS, often talk about kind of things of like examples of waste and efficiency, and they'll say, it's not how much money the healthcare is getting, it's not that the NHS has more money, it just needs to spend it better. And generally, that tends to involve having more middle managers between different hospitals, all things which actually tend to just waste a load of money and stop money going to frontline services. The other thing is worth saying that actually the things that we're told will promote efficiency often don't. The UK's healthcare system remains, for the most part, free at the point of use, which means that if you go to the doctors or you go to the hospital, get picked up by an ambulance, you won't be charged for seeing that healthcare professional. You won't be charged for any medication that you're given whilst you're an inpatient. So if you're in the hospital lying in the bed and they give you something in a drip, you won't be charged for that. One of the things that Wes Streeting has been pushing for is the introduction of more competition, which the specific way he wants to do it is that you'll essentially have a kind of TripAdvisor for hospitals where people can rate their experience of going to a particular hospital. And I assume that findings by the like CQC and various bodies that like inspect hospitals to see how they're doing would also be included on that. And that patients, rather than having to go to their local hospital for something, would be able to go wherever they want in the country. And the idea is that this motivates hospitals to, and doctor surgeries to kind of be better because they want to attract patients. The problem is that that doesn't motivate hospitals on the most part to hire more staff, like frontline staff in terms of hiring more doctors and nurses, or to pay those doctors and nurses better, or to improve their facilities. Often what that encourages hospitals to do is to hire the kinds of people that are good at working out how to increase the scores that they'll get. So, bringing in consultants that are going to help them to kind of massage those scores a little bit. And it also leads to this position where, personally, I don't want to be able to choose which, I'm not that bothered about being able to choose which doctor surgery I go to or which hospital I go to. I would much rather that I knew the one that was closest to me was good, not that I had the option of going up north somewhere to go to hospital instead. So dentists in the UK, you do have to pay to go to the dentist, but what they've also done is cut the amount of money that dentists get if you go to an NHS dentist, which means there is now very few NHS dentists. I have had to go private for my dentist because the waiting list where I live is at least 7 years long. It cost me a lot of money to do that. The real benefit of the NHS system, the fact that there isn't competition. So one of the reasons that medicines are cheaper in the UK is because where in other countries individual practices or individual hospitals or hospital systems go to pharmaceutical companies and go, can we have some insulin, please? And they're a kind of small company that is trying to get a good deal. The NHS goes, hi, we're the National Health Service for the United Kingdom, Great Britain and Northern Ireland. This is how much we're going to pay. If you're not willing to provide it for that amount of money, we'll go somewhere else. Like, they literally set out a list of how much money they will pay for different things. And pharmaceutical companies either say, yes, we'll pay that, or they say, no, they won't. Healthcare is not a competition. One really good example of the ways in which we are moving towards that kind of system where private companies are providing healthcare sort of on behalf of the NHS, even though it's still free for people, is that Virgin, that owns Virgin Airlines, etc., does that and instead. And so the idea of competition here is that lots of different companies and organizations can like pitch for that work for a set amount of time. One of these companies will put together the offer that is the best value for money, etc. But in reality, this is always going to be less efficient because a private company is going to be taking a slither of profit off the top. So Wes Street and Keir Starmer, this kind of version of the Labour Party that currently exists, are not like actively popular. They don't have any real active support. People are dissatisfied with the current government and therefore have decided they're going to vote Labour for a bit of change. That might win them one election, but it potentially leads to a situation where from like day one of being the government, they're a deeply unpopular government, right? Because people have voted them in to not be the Tories, and then they continue to do a load of Tory stuff. Like to be doing any kind of austerity politics, to be doing any kind of cuts, to not be giving the NHS more money at this stage, there's not going to be much of a British state to govern, essentially.